Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta with Chief Medical Officer of Health, Dr. Deena Hinshaw. Dr. Hinshaw will provide an update and then we'll open the floor to questions. I'll now turn it over to Dr. Hinshaw.
Thank you, Zoe, and good afternoon, everyone. Before we begin, I would like to recognize that today is National Child Day. COVID-19 has been a difficult time for us all, and it has brought a lot of change and uncertainty for our children. Children have had to adapt the way they learn and the way they play. They've missed out on school field trips, birthday parties, and hugs from grandparents. We've asked our children to make significant sacrifices, and we cannot forget the impact that restrictions and COVID-19 losses can have on children's emotional, physical, and mental health, overall well-being, and social development. So on National Child Day, I encourage each Albertan to think of the children in their life as motivation to recommit to the public health measures. The choices we make today will have an impact on their schools, their childcare arrangements, their sports and after-school activities, and their ability to be close to loved ones who may be at risk of severe outcomes. Our current situation is grim. Over the past 24 hours, we have identified 1,155 new cases of COVID-19 and have completed over 17,000 tests. This means our provincial positivity rate sits at about 6.5%, and we currently have 10,655 active cases. There are 310 people in hospital. Of those, 58 are in ICU. Sadly, I must report 11 new deaths over the past 24 hours. 11 fellow Albertans are gone, and their families and friends are mourning their loss. They and everyone else who has lost a loved one recently must navigate the experience without many of the ways we normally comfort one another. I encourage all of us to reach out to anyone we know who is grieving a loss, to let them know that they are not alone. I continue to be concerned about the rise in these tragic outcomes of COVID-19. Severe outcomes are not limited just to those already at the very end of their lives, and it is a mistake to think so. This week, 2 individuals in their 30s died as a result of this virus. While both had comorbidities, these were not on their own life-threatening. The average age of people experiencing hospitalization is dropping. And about 1 in 4 people who need hospital care for COVID-19 and 1 out of every 6 in ICU with COVID-19 have no pre-existing medical conditions. It is also important to remember that having a chronic medical condition is very common. These conditions include things like high blood pressure and diabetes. In Alberta, almost 1/4 of all adults over the age of 20 have a chronic condition. That is almost 800,000 people. 10% have 2 conditions, and 8% have 3 or more. Older adults are more likely to have medical conditions. For example, of those over age 50, 65% have 1 or more chronic conditions. When looking just at men in Alberta, more than half of men over 50 and almost 70% of men over 65 have high blood pressure. That should not be a death sentence. Most Albertans will have a family member or friend with these conditions. We must remember that our actions protect these people as well as ourselves. With rising hospitalizations and ICU admissions, combined with ongoing outbreaks at multiple acute care and continuing care facilities across the province, AHS is working to increase capacity for COVID-19 patients if needed. Throughout the pandemic response, I've indicated 70 general ICU beds have been planned for patients who test positive for COVID-19. On Wednesday, I said that 81% of these beds were occupied, and I've heard that my use of this number is causing greater anxiety as Albertans see us getting closer to that threshold. Let me be clear, Alberta Health Services manages ICU beds and staff depending on demand from both COVID-19 patients and patients with other conditions that require intensive care. There are 173 general adult ICU beds for this purpose. These beds can be used for many patient types. I want to assure Albertans that as more COVID-19 patients require intensive care, AHS is able to add additional intensive care capacity. AHS has already readied additional ICU beds in Edmonton zone, and additional ICU spaces in Calgary zone will be ready if needed. This is where most of the capacity is likely to be required, but creating this capacity means stopping or delaying other services, and this is the impact we want to avoid. Demand for COVID-19 is still high, and the system is taxed. I continue to urge Albertans to help us reduce demand on our ICUs and on our hospitals by following all measures in place. The best way to ensure capacity is available and to drive hospitalizations down is to reduce community transmission, which in turn will reduce the need for additional COVID-19 beds. Another way we can support our healthcare system is to keep healthcare facilities safe. Recently, Alberta Health Services has had several situations where designated family or support people of patients intentionally did not disclose their COVID-19 related symptom status. While the vast majority of Albertans understand that doing this puts loved ones and the teams caring for their loved ones at even greater risk of illness, the few who choose to do this are impacting us all. Please be honest. We are dealing with a multiplier effect in Alberta. We cannot afford that in our healthcare facilities. We cannot risk having one COVID-19 positive person who does not isolate and expose others. I understand that it is hard to not be able to see a loved one or accompany them to hospital, but we must all think beyond ourselves right now. If a provider or other member of a healthcare team gets sick, it means they are not available to treat patients for at least 2 weeks, which translates to a lack of staff to care for all patients. This also means that we don't have enough staff to support our many other healthcare services, including elective and non-urgent surgeries, care appointments, and more. Ultimately, if this behavior continues, Alberta Health Service will have to consider limiting designated family and support and visitation even further. And that is not something we want AHS to have to do. Do not go to a healthcare facility if you are feeling sick, unless, of course, you yourself need care. Answer honestly and fully when asked screening questions at any healthcare facility. Speak with site screeners about your symptoms and contacts. They are here to work with you. We are all here to work together. Turning to schools, there are currently active alerts or outbreaks in 294 schools, or about 12% of all schools in Alberta. This number includes 67 schools that are currently on the watch list. So far, in-school transmission has likely occurred in 166 schools. Of these, about 87 had only one new case as a result. Schools do not operate in a closed system. Students, guardians, teachers, parents, and staff are part of our communities. As we continue to have increasing cases throughout Alberta, this will correlate with cases in our institutions, including school and hospital. In the past week, we have confirmed more new active cases than we have in any previous week to date. Contact tracers are working heroically to address the backlog, but with the current volume, they're fighting an uphill battle. There are still more people and more cases out there that we don't know about. We must all continue to do our part to help the contact tracers. If you test positive for COVID-19, follow the directions that you were given. If you are asked to visit the AHS online portal, please submit the information for your known close contacts. I know many worried about being blamed or stigmatized, and I want to stress that this process is anonymous. When your close contacts receive a text, they will be told to isolate and be given information on symptoms, isolating, and testing. But I want to be clear, they are not given your name. On the other side, if you receive one of these text messages that indicates you were a close contact, follow the instructions you were given. You must stay home and isolate for 14 days from your last contact with a positive case. Monitor for symptoms and arrange for testing if needed. Otherwise, do not leave your property. And please respond back to the text message so contact tracers can determine what additional follow-up may be required. Finally, if you are an event organizer and are asked to notify attendees, please do so as soon as possible. As I said Wednesday, many recently diagnosed COVID-19 cases have had no known source of exposure. Over the past 7 days, this number has become larger as contact tracers have faced additional challenges to keep up with the demand. Our actions, such as going out while symptomatic, have very real consequences to those around us, whether we know about it or not. I often ask Albertans to follow public health measures to protect their loved ones. It is easy to think of a cherished family member or friend, but I want to remind everyone that the health of those we don't know is just as important. Every time COVID spreads, it is a threat to our health, the health of others, and our healthcare system. Every spreading event jeopardizes businesses and activities that could potentially face more intrusive measures than those we introduced last week. This weekend, I encourage everyone to abide by all public health measures, even if you don't like them, even if they're inconvenient, or even if you don't agree with them. We must all do our part to bend the curve, prevent the healthcare system from being overwhelmed, and prevent more restrictive measures from coming into effect. We are all tired, and the stakes are higher now than ever before. It is harder to keep an even temper when our perspectives are being challenged. I know it's not easy for any of us right now, and yet kindness and firmness are more important than ever before. We need to give ourselves and others permission to grieve, as there is much that we have lost and are losing. Everyone is carrying heavy burdens right now. Please be compassionate with yourself and with others, and remember that we can only get through this by working together. Thank you, and I'm happy to take questions.
Okay, there are many questions queued up today. As a reminder, please limit yourself to one question so we can take as many of them as possible. Operator, would you please put through the first caller? Operator, are you there? Operator?
Hello, the question is from Jeff Slack, 660 News.
Hi, Dr. Hinshaw. It's been a week since the province introduced the targeted restrictions on bars and fitness groups. Do you think these measures are working, and should Albertans anticipate for more restrictive measures next week, similar to Ontario's announcement, which included retails being open for pickup and delivery, with certain exceptions for supermarket and grocery stores?
It typically takes about a week for us to start to see the impact of restrictions. And so given that the new restrictions went into place last Friday, we would expect to start to see any impact of those over this weekend. What I will say is, of course, our current case numbers remain extremely concerning, as the number of cases in hospital and ICU is also very concerning. And so we're watching those very closely and preparing the recommendations to bring forward to our elected decision makers for their consideration. And no decisions have yet been made, but of course we are watching very closely and considering what may need to be done if our numbers do not go down.
Operator, could you please put through the next question?
Yes, the next question is from Jason Herring, Post Media.
Hi there, Dr. Hinshaw. Thank you for taking my question. I wanted to ask about a provincial mask mandate. Yesterday, as part of BC's new restrictions, they added a provincial mandate, and they became the 9th province to do so, meaning Alberta is the only province that has yet to introduce this. Are there any plans on bringing a mask mandate to Alberta?
All of the policy decisions about how to respond to the pandemic are discussed, and the benefits and challenges are looked at carefully. A decision has not been made about whether or not a mask mandate would be a part of any additional measures in the province. But of course, as you say, we are watching neighboring provinces and looking very closely at the evidence so that we can consider options based on the evidence of effectiveness as well as the context in Alberta.
Operator, could you please put through the next caller? Hello, operator? Please stand by. We'll try one more time. Operator, could you please put through the next caller? Thank you for your patience, everybody. We'll just wait and see if we can reconnect with the operator. We'll try one more time. Operator, are you there?
Hi, sorry, this is the operator. The initial operator lost their connection. Our apologies. Be just one moment, please.
Thank you. Please stand by.
Okay, my apologies. Don Braid, we have you next.
Thank you. Go ahead, Don.
Go ahead, please.
Dr. Hinshaw, could you explain, I believe there are 70 ICU beds, of which 58 are now in use, and you can make another 103 available. Am I correct in those numbers? And I think this question has been asked before, but I guess it becomes increasingly urgent. At what pace can you make these beds available? Can you keep up, do you think, with the coming surge?
Alberta Health Services has always had a suite of several hundred ICU beds, and the number of 70 was chosen in the spring as a metric that would help us understand when our cases were starting to put pressure on the system. So that was never the entirety of all the ICU beds, but rather that metric that would help us understand where we needed to start taking action. And so the 173 that is the general ICU beds that AHS has, they can make those available, and they are working to do so. Part of that is bringing some extra spaces online, and part of that is slowing down other services to limit the need for those spaces by people with other health conditions. But of course, the reason that we are not wanting to have all of those beds to be filled with COVID patients, of course, they could be made available, but what that would mean is we would be less able to offer services to people with other health needs. And Alberta Health Services, as I mentioned, has been putting additional beds into service. In Edmonton zone in particular, they have been, over the past several weeks, moving to reduce some of the other procedures they're doing to try to free up capacity. So at the moment, AHS is absolutely responding to the need in a timely way. But as I've said before, those expanded capacity beds for COVID mean less services for other people. And we cannot simply expand to the full scope of all of our beds in the system, as that would put other people at risk for other health issues.
Operator, could you please put through the next caller?
Yes, next is Dean Bennett with the Canadian Press. Go ahead, Dean.
Well, thanks very much. Thanks, Dr. Hinshaw. You mentioned this week that you're concerned that some groups are ignoring or flouting the rules that were put in place last Thursday. I'm just wondering, it makes me wonder, I'm still looking for the evidence and some of the more core reasons why you made some of the decisions that you did. Some of the fitness group owners this week, they've said they have no idea why they were singled out. The minister in the House yesterday said you made a decision because of 3 super spreader groups and fitness classes. That's news to me, and I haven't been able to find anywhere to explain, to see what the rationale was for the fitness groups, for the team sports, for example, why worship services were asked to be 1/3, but it's voluntary. I'm wondering if that information is not available, why isn't it? And is there a concern that if you want people to buy in, do you think maybe they would buy in more if they had more information so that they can understand why they're doing what they're doing?
It's a good point, and I've spoken generally about the reasons, but as you say, perhaps we need to make specific information available. The reason for the measures that were put in place last week, we looked at all of those settings where we have both had experience in Alberta with super spreading events, as well as settings where there is ample evidence from around the world that in those settings, and again, I want to recognize that many, many people in those settings have put in additional measures to increase safety in those settings. However, those settings are the absolute highest risk for one person who's infectious showing up, and if there is a slip in protocols, having that one person transmit to many others at the same time. And so we are focused on those kinds of events like sports, team sports, like fitness, group fitness activities, worship, those and social gatherings. Those are the types of events and activities that we have seen that significant number of spread from a single gathering or single event. And so if it would be helpful for people if we list out the number of those types of activities where we have seen outbreaks, then we can certainly work to do that because, as I say, it's based both on our own experience in this province as well as those being routinely identified as the highest risk types of settings around the world with respect to large spreading events.
Operator, could you please put through the next caller? We'll just wait one more second for the operator.
I'm sorry, go ahead, please. Julia Wong with Global News.
Hi, Dr. Hinshaw. I'm looking to get a clearer understanding of what the thresholds are for more measures and a roadmap so Albertans know what they can or cannot expect. We've had some previous triggers that seem to have come and gone without new restrictions introduced, like passing that threshold of 50% of the COVID ICU beds that was 70 at the time. So what specific triggers, such as R-value, positivity rates, specific daily case numbers, acute care capacities, what specific triggers are being used to determine when or if more restrictions will be brought in?
I guess I have a different perspective on actions taken with triggers. So we were watching closely our case numbers and R-value as one of those leading indicators. And we did put in some additional measures in early October in Edmonton and surrounding area. We then started to see additional concerns happening in Edmonton with respect to the acute care capacity. You'll recall that Edmonton, although they didn't pass that 50% growth rate over a certain prolonged period of time, what we did see is 120% capacity being hit. We've certainly learned over the past couple of months that we do need to adjust our indicators, so we're looking at that capacity metric. And so in response to passing that capacity metric, we did put additional restrictions in place on gatherings in Edmonton and Calgary. We then, unfortunately, did pass that 50% of our threshold ICU. Again, that was the trigger that was used because that would give us an indication that the increasing growth would start to impact those other services. And in response to that, we did put in additional measures last week that came into effect on Friday to focus on those large spreading potential events and facilities. So we have responded to those metrics all along by putting in place additional restrictions that have been targeted on the activities, events, and locations where we've seen evidence in the province of additional spread. Of course, as I said before, we are looking to see the impacts of those measures, and we are concerned about the increase in acute care utilization. I recognize that it would be convenient for people to have that roadmap laid out, but what we've always committed to in Alberta is being able to respond with our own current data and using the data to inform any restrictions that are being driven with respect to the the target of those. Of course, right now, we are in a difficult spot because we are seeing less data with the challenges in contact tracing. And so we will have to be looking not only at our own experience, but looking at experiences of other jurisdictions should we need to consider additional measures. And any change to more of a roadmap type framework would, of course, mean that we would, by necessity, need to move away from that more localized data. And so there's a tension in that. But of course, we recognize that that kind of predictability would be helpful for Albertans, and so that is something that we're looking at closely.
Operator, could you please put through the next caller?
Next is James Keller with the Globe and Mail. Go ahead, James.
Hi, Dr. Hinshaw. You've talked about the low number of infections in restaurants, fewer than 1% of cases, and you've also said that evidence from other jurisdictions supports the idea that they're not significant sources of spread. So can you talk about how difficult it will be to determine the trouble areas with contact tracing as limited as it is? And can you also explain what evidence you've seen from elsewhere? I think there have been a few studies, notably a highly publicized one out of the CDC in the U.S. A couple months ago that showed a strong relationship between dining and infection risk.
Absolutely, and it's interesting, as you say, because there have been different studies that point to restaurants and bars as a source of transmission. And of course, if there are no measures in place in restaurants and bars, if people are able to mingle freely, if they're not seated separate from other tables, if you have large groups seated together all at the same table. So in short, if you didn't have the measures that we have in place to prevent spread in bars and restaurants, then absolutely it's not surprising that in a place like the US, where many states have not had significant restrictions, you would see that as a significant source of spread. We have been looking at BC's experience, and the information in BC has been quite similar to ours with respect to not seeing bars and restaurants that have restrictions in place significantly driving spread. But of course, we do need to consider as we move forward whether or not we need to put additional measures in place, whether or not we do start to see our numbers start to trend downwards, if we do start to see the early impacts of the measures put in place last week. And if cases continue to rise, we will have to consider what other measures might be appropriate at this time.
Operator, could you please put through the next caller?
Next is Rafi Bujikanian with CBC. Go ahead, Rafi.
Hi, Dr. Hinshaw. When one of us asked you about a pending mask mandate, I didn't hear you say whether or not that's something you have specifically recommended yet to the government. And so I'm wondering, can you tell us what measures you have recommended specifically to the government this week?
So this week, what I've been doing is working with my team to prepare the suite of things under consideration. And the discussion about which measures would be deemed appropriate has not yet happened. So again, right now we're in that preparation phase.
Operator, could you please put through the next caller?
Next is Bill Fortier with CTV News. Go ahead, Bill.
Hi, Dr. Hinshaw. You've already been asked about the mask restriction in every other province, but also other provinces that are being hit hard are now shutting down inside bars and restaurants and actually restricting people from going to each other's houses. We're not doing any of those things. We're recommending it. So I know you're not the Premier, but you're directly advised by the Premier and the government. So why is Alberta doing less than almost every other province, actually than every other province that's hard hit, when we're seeing these huge numbers of cases similar to Ontario and Quebec?
Of course, I cannot speak for the Premier, so those questions in terms of the decisions on policy would be best directed to the elected officials to make those decisions. But what I will say as a part of the recommendations that I've made has always been a consideration of the impacts of COVID-19 and the impacts that restrictions have. And I've always said that as the Chief Medical Officer of Health, I'm responsible for the whole health of the population. That includes COVID-19 and other aspects of their health. And I will say that it has been challenging to consider what the right balance is and what that right suite of measures would be to be able to bring down COVID-19 while maintaining the mental health benefits of the activity and socialization, the benefits of being employed, the benefits of being able to have physical activity. And so those are some of the considerations that I've taken into account as I've made my recommendations, and also wanted to be able to give as much opportunity as possible to try to control the pandemic with a suite of measures that had the minimum impacts on people's health in other ways. Of course, I am concerned, and the measures that we have put in place over the past several months may have somewhat slowed the growth, but they have not bent the curve as much as we need to. And we do need everyone to pull together to follow all of those measures to the letter, or unfortunately, we will need to put in additional restrictions. I will need to make recommendations on additional restrictions, and I recognize those may have other health impacts, but we cannot let COVID-19 spread unchecked.
We have time for 2 more questions today. Operator, could you put through the next question, please?
Next is Janet French with CBC. Go ahead, Janet.
Hi there. Thanks for taking my question. Regarding the single site rule, so since November 4th, we've seen the number of care homes that have exemptions from the single site rule rise to 22 from 10, and I count them at 26 different locations. What did operators say to you to convince you that these exemptions were warranted? And what is the purpose of these exemptions if many of them are granted to places where there are already outbreaks?
The unfortunate reality of outbreaks in continuing care is that often if an outbreak has started to accelerate in a continuing care home, there are often many staff who are impacted by potentially being close contacts or themselves being sick. When that happens, those care homes experience significant staffing shortages, and they are not able to provide adequate care for their residents for all of their care needs without additional staff coming in. And so the single site exemptions that I have granted have been on the consideration of the fact that operators simply are not able to meet all their residents' care needs in a safe way without allowing staff who typically work at another site to come and work at that outbreak site for a period of time until the care needs can be met with those staff who perhaps were out either quarantined or ill, who've recovered, being able to come back. So it really is about allowing the safe care provision for all the residents' needs and allowing workers to come to that site and help support the other staff who are there.
Operator, could you please put through our final question?
Final question is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. I have a point of clarification and a question. Just wondering if you can clarify when we can expect to see daily case testing numbers again. Now, the question, you are once again not joined by the Premier or the Health Minister. Do you think it would be easier to communicate health priorities and to speak directly with the public if you had the visual backing of our elected political leaders?
With respect to the clarification, we expect that our testing numbers will be ready again by early next week. We did have a couple of weeks ago that challenge with respect to the flow of data. You'll recall I talked about that. We have the lab that's doing the testing, and there's sort of that data pipeline that then comes and feeds the tests into our systems that we use to do all of our analytics. And so we first needed to identify the source of the issues. We needed to fix those issues. And then we needed to take all of the information that came kind of in one big bolus through that pipeline and allocate it to the appropriate dates. So that all took some time, and that should be ready by early next week. I recognize that it has been unfortunate that we haven't been able to provide that for the last couple of weeks, but it will be available, as I say, very soon. With respect to the availabilities and the attendance at them, I think that there are different roles and responsibilities in responding to the pandemic, and I always do my best to provide Albertans with accurate information and with the benefit of the daily numbers, of the occurrences that are happening. And with respect to the attendance of elected officials, their role typically has been to attend when there are announcements and changes that are being made. And so, again, everyone has very busy schedules, and that's simply the way that has been arranged at this time.
Thank you, Dr. Hinshaw. That concludes today's availability. Our apologies for the technical issues we experienced this afternoon. We will provide another update on Monday afternoon. Thank you, and have a safe weekend.